The development of cataracts is really just a natural process of the eye aging. Cataracts form when the natural lens of the eye, which sits right behind the pupil of the eye, starts to become cloudy, where it once used to be clear whenever you were younger. So with the cloudiness of the lens and the cataract forming, you start to get blurred vision. That can cause difficulty with reading and performing your daily routine, especially with driving, and most commonly driving at nighttime with significant glares and halos noted in your vision. The good thing is this decreased vision that cataracts cause is reversible. Cataracts surgery is the most common surgery performed worldwide, with over 3 million cataract surgeries performed each year in the United States. And at this time, people going through cataract surgery have more advanced options available to them than ever before. With traditional cataract surgery, what we do is we make a small incision through the cornea, which is the clear window on the front part of the eye, in order to access into the eye and to get to the cataract. The cataract is surrounded by a capsule. We first have to put a hole in the front part of that capsule in order to actually get to the cataract. We then use phacoemulsification, which is ultrasound energy, in order to break that cataract into smaller pieces and remove it completely. We then polish the capsule that the cataract once sat in and put a new clear intraocular lens into that same spot inside that capsule. That lens is going to be with you for the rest of your life. Now traditionally, and what insurance companies will cover, is for a monofocal lens. This means that all the light that goes through that lens is going to have one focal point. And usually that is set to try to give you the best distance vision possible. However, you would be dependent on bifocals, trifocals, or reading glasses in order to read up close. The other thing that the monofocal lens will not correct is for any corneal astigmatism. Now, corneal astigmatism, the cornea is supposed to be kind of circular shaped, kind of basketball shaped. However, if you have some astigmatism, it's usually more of an oval shape, like a football. And so there are parts of that cornea that are going to bend light differently than other parts of the cornea. If you have significant astigmatism, then your vision without glasses, with just a traditional lens, probably is not going to be as good as you would like it, and you would probably be dependent on glasses for your distance vision as well. However, we do have toric lenses which correct for astigmatism that can be implanted at the time of surgery, oriented in a particular axis, and gives you a better chance of having good distance vision without needing glasses for distance. However, you would need glasses still for reading up close. Now, insurance companies will not cover the astigmatism correcting lens because it's not necessarily improving your eye health or anything. It's just improving potentially your lifestyle and the convenience of not necessarily having to wear glasses for distance. So this ends up being an out-of-pocket expense. Now, for some people, they want to have the ability to not have to wear even reading glasses. They want to be able to have good distance vision and good up-close vision. For those people, we now have what we call multifocal lenses that we can implant at the time of surgery. Now, multifocal lenses, what they do is they actually split the light as it enters your eye into two different focal points. It'll send 80% of the light to focus for distance and 20% of the light to focus for up close. Again, this is to try to decrease your dependency on glasses. However, it might not completely eliminate your need to have to use glasses. With multifocal lenses, we expect certainly to have good distance vision as well as much improved near vision, especially for helping you with seeing things in groceries, reading tags when you're shopping or in the grocery store, or looking at your watch or your cell phone. However, if you were going to be reading for a prolonged period of time, you might still benefit from using reading glasses. For people who want to be free from glasses altogether, we have an option called the multifocal intraocular lens called the Restore. Now, this lens works by actually splitting light as it passes through your eye into two focal points, a distance focal point and a near focal point. Now, compared to a traditional lens, this lens is certainly going to give you superior near vision. You'll be able to do things like checking your wristwatch, checking your phone, or reading a menu in a restaurant without necessarily having to pull out your reading glasses in order to see that. So certainly the difference in the multifocal relative to the traditional lens is what you see without your glasses. And However, people with the multifocal lens, sometimes if you were going to be reading for a prolonged period of time, you might find some convenience by using reading glasses. It might put less strain on your eyes. So compared to the traditional cataract surgery, where we actually use blades to make incisions into the eye, we now have an exciting new option called the LensX, which is a laser-assisted cataract surgery, where we actually set up the laser to make all the incisions for us. Now, one of the advantages that the LensX provides for us is that at the time of surgery, we can make incisions in the cornea that actually relieve little bits of astigmatism. This allows us to be perfectly precise during surgery, during multiple parts of the procedure. And so for patients who want just the most precise, most accurate cataract surgery, the LensX is a great option. Now with the LensX, again, we're not necessarily improving the health of your eye versus traditional cataract surgery, and so this isn't something that's covered by insurance. However, it certainly gives us the best chance of having a good visual outcome without necessarily needing glasses for your distance vision.